All right, does everybody see my hip pain presentation? No, I haven't hit the right button yet. It's going, I promise. I have 2 black screens right now. Not responding. That's not good. Does everyone see the present? Give me 1 second, guys, if you can hear me. How am I doing? Can you guys hear me now?
Hear you and see your screen share.
And do we see hip pain?
Yes, we do.
Okay, good. My computer was just going real slow. It just kind of hit a dead stop. Okay, here we go. Hip pain. All right, as always, I like to start with some anatomy. I'm not going to go through all this because, as you can see, the anatomy of the hip is very, very complex, okay? I will touch on a few of these muscles, the ones that I feel are the more important ones. Okay, so this is the backside of the hip over here on the left. Okay, we have the big gluteus maximus muscle removed, okay? I'm pretty sure we're all pretty familiar where that big guy is, right? It kind of covers all this here. Underneath, we have the gluteus medius, okay? That's the middle of the big glute muscle complex. It's a very important muscle for hip movement. Then we have this little triangular muscle in here that we call the piriformis. Anybody with any sort of sciatica issues, sciatica type issues, typically has a problem with this muscle. So we'll be addressing that. And then we have all of these other muscles within the hip. Right here is the hamstring complex. Okay, there's actually 3 muscles that make up the hamstrings. Okay, that actually attaches to the bone right here that we actually sit on. So we actually sit on the insertion of our hamstrings all day long. Okay, so that's going to be important to know that we're going to keep those loosened up because we're tightening them up all day. Now here's the front view. Okay, so you can see the spine all the way in here. One of our big important hip flexor muscles actually attaches to 4 or 5 of our spinous processes out here on the side of our spine. So we can see how important the hip is in relation to our spine. Hip bone is connected to the backbone. Okay, so perfect example right there of how that works. These 2 muscles right here, these combine together to form what we call the iliopsoas. That's one of our big hip flexor muscles, and a lot of times we can get what we call iliopsoas tendinitis. Okay, and I'll kind of give you a picture of that here in a little bit. Then we have the tensor fascia lata on the side. TFL is what a lot of people will refer that as. And then one of our quadriceps muscles is actually a hip flexor as well. That is the rectus femoris right here, okay? Then this whole group in here is what a lot of people will refer to as, the groin area. If you pull a groin, it's usually one of these muscles. These are called what we call adductors, ADD ductors. So you can see adductor brevis, adductor longus, adductor magnus. All of those guys are within there, okay? So those we can often be tight or get injured as well with different movements. Check the chat box real quick. Maybe a bad idea. Okay, going a little bit deeper, we have the joint capsule, like we talked about last week around the knee. Okay, we have a joint capsule around the hip as well. The hip actually is made up of several ligaments right around the hip capsule. So you can see these ligaments can often restrict movement and cause tightness. So if we don't keep these, at an optimal length, that's going to tighten down. It's going to pull on that capsule underneath here. Again, just like in the knee, eventually leading to a potential hip arthritis. Okay, then underneath even all that, we're looking down here at the head of the femur. Okay, so this is actually where the bone comes in contact with the pelvis right here. Okay, so there is a little labrum in here. It's a little piece of tissue that kind of makes this socket deeper, if you will. So the bone you can see kind of goes right here, right? But then there's a labrum that makes it a little bit bigger, which helps hold in the head of that femur bone, okay? And then you can see, again, the joint capsule all around it. This is going to be important here for in the next couple slides. So again, arthritis. This is typically one of those things that you wake up in the morning and your hip feels stiff, but then it kind of feels like it loosens up throughout the day. That's one of our key, pieces of information with arthritis. Okay. You can see that these bones and these joint surfaces just kind of wear out and they just start looking kind of ugly, right? We're not getting that nice, smooth separation between the two bony areas. And that's where we'll end up getting some of that hip pain from, okay? But as we get up and get moving, it typically gets loosened up. This one's a mouthful, okay? Femoral acetabular impingement. This is one of those things it's kind of hard to diagnose because it can be disguised as something else. But essentially what we're looking at, if you remember that picture I showed you before of that labrum that kind of sticks out, sometimes in different populations that can become calcified and create a little bony prominence right there. We call it a pincer, okay? So if you were imagining this bone right here, your upper leg flexing up or kind of out to the side, these areas right here are going to hit this much sooner than it should. So we're going to get like a pinching pain, a pain that's just not comfortable, okay? So we call that a pincer. But then we also have what we can have as a cam. Okay, it's just a different type of impingement where the bony growth is actually on this part of the hip right here. It's actually on the femur. Okay, so now when you go to flex that leg up, that little bony prominence is going to hit right into this rim of the pelvis. Okay, so then we'll get that pinching sensation, the feeling as well. Sometimes it's not bony issues that are causing the impingement. Sometimes it's the iliopsoas tendon kind of runs through this area. It can get impinged. There's bunch of other structures like the capsule and those ligaments can get impinged as we go up. Okay, so the only way to really kind of, test that out is if somebody grabs your knee and kind of pulls it up to your chest and you feel that pinching, shooting type pain. It's a pretty good indicator of that we have some sort of impingement going on. Then there's a bunch of bursae, if you will, in and around the hip. Okay, this one down here, this one's not very common whatsoever. That's just kind of your bottom gets a little bit sore and a little inflamed where you're sitting. That one, you just kind of shift your hip and it feels a little bit better. But these other ones, we see kind of often. These bursa that we have, they sit underneath muscles that get used a lot, okay? And essentially what it is a buffer, okay? So that these bony prominences that we have in different areas of this femur bone aren't scraping against these muscles that need to glide nice and smoothly across it, okay? So I would say the two biggest ones are this iliopsoas bursa, okay? Like I talked about, there's this big muscle here and one that comes from the spine, all run down through here, okay? So anytime that hip flexor contracts, it should go across this bursa nice and smooth. If we have this a little inflamed and it's not happy, every time you perform that movement, you're going to feel a little bit of pain in that area, okay? And then the other big one is the one over here, the trochanteric bursa. It's right on the side of the hip. That's if you kind of bring your leg across or different movements that you can do can kind of flare that one up. That one's a big one. That's a big old bursa sitting right there. And I can usually take my finger and push right on it and you go, ow, if that's what's going on. Okay, so that one's pretty easy to kind of pinpoint if that's what's going on. Okay, so a lot of different things can be happening in the hip. Big one we see a lot. Unfortunately, this is kind of a catch-all term, piriformis syndrome. There's a lot that comes with this, and a lot of people get misdiagnosed with this. But essentially, if you look at this big bundle of nerves right here, okay, all of these nerves are coming from this lumbar and sacral spine. Okay, so your lower back and down into your sacrum here. These important nerves come out of there and they come up into one big bundle. Anybody know what this nerve is called?
Sciatica.
It's your sciatic nerve. Okay, so this is where everyone talks about sciatica. You get sciatic symptoms down the leg. This big bundle of nerves right here that comes out, that's your sciatic nerve, okay? In about 95% of the population, it comes out either right above, right through, or right below the piriformis muscle, okay? So that's why I said earlier, this is an important muscle that we're gonna wanna keep, you know, limber and keep stretched out, because if this muscle tightens up and you get that sciatic nerve kind of running right through it, you're gonna get that pinching and you're gonna get that sensation down the leg, okay? So that's the numbness and tingling down into the leg. A lot of people like to talk about your IT band syndrome. You see a lot of people who will foam roll their IT band and do all that stuff. But technically, this white tissue that you see right here, you can't really change it very much. It's fascia, it's tight. It's not like a muscle that we can lengthen, okay? But there's two muscles that start this IT band. Okay, this is on the outside of your leg over here. The TFL, I talked about earlier. It's one of the hip flexors is in the front of your hip, and then the gluteus medius, like I talked about earlier as well. These two come together and form this big band that comes down along the side. And if that's tight and these muscles are tight and it's pulling on this, it can actually, it's more so knee pain, but the muscles originate in the hip. So that's why I kind of put it in this presentation. So as you can see, there's a lot going on in the hip. Okay, a lot of different things that we can find. Let's see, I'm going to stop sharing my screen because I'm going to walk through these exercises. Well, let me show you these ones first. The hamstring one, you guys should be very familiar with that. We do that for just about everything. Okay, anything low back, knee, calf, ankle, you know, we'll work on here. But then the other two, I'm going to demonstrate this first one, but this last one's pretty easy. You just lay on a high table, let this leg fall off the table, and you'll feel a nice stretch in the front of that hip. Okay, but I do want to walk through the piriformis stretch, and I'm going to walk through this exercise right here because it has become one of my favorite, and then I'm going to give you a bonus stretch as well because I'm already running short on time. Hips are very complicated. All right, so do you guys see me now?
Yep.
Perfect. All right, so the first one, I want to go through the piriformis stretch. Chair away. So I like this one a lot. So if I want to stretch my left piriformis, I'm going to cross it over my right leg, my right knee, okay? Then I'm going to take my hands and I'm going to reach them through and grab that right knee. And give it a big hug, okay? And you should feel a nice stretch in the middle of your glute, okay? You don't want to feel the whole glute stretching. You should feel a kind of pinpoint area, more dead center, okay? So that's your piriformis stretch. Anybody who thinks they may have some sort of sciatic stuff, that's your stretch, okay? If you do this for every day for a couple of weeks and your symptoms don't go away, then it's not likely coming from piriformis, okay? So I like that one a lot. And then the other one I want to go over, where'd my little band go? All right. A mini band, right? These are my favorite, okay? So I want you to take this band, and you're going to wrap it around your ankles, okay? You're going to bring it up to just above your knees, okay? Now, all I'm going to do is go into a little mini squat. Oh, you guys can't really see that, can you? Hopefully this will stay there. So it's right here above my knees, okay? I'm going to go into a little mini squat. I'm just going to hold it. Okay? And then I'm going to open the knees up. Okay? You don't move your feet stay stationary. Okay? So I'm in that mini squat position. Open up. Really great exercise for hips. And then the bonus exercise I'm going to give you, I didn't put it in the slide, but I absolutely love it.
I have a question.
Yeah, what you got?
So for that one with the band on the knees, do you exercise like a full range? So you bring your knees as close together as your body allows and then go all the way back out again?
No. So we want to maintain that kind of squat position and open it up from there. Okay. Don't let them buckle in.
Oh, okay.
Yeah, we want to maintain that squat out back to the squat position.
Pigeon toe, non-pigeon toe, like straight toes.
Slightly out. So the muscle we're working is a hip external rotator. So we want to put our feet in slight, what we call external rotation.
Okay.
Okay, so that's going to help that muscle fire even more. Okay. Mm-hmm. Then the last one, you're going to get a cup, something that's maybe a couple inches high. You're going to sit. You're going to put it on the outside of your foot. Everybody see that? So I'm going to lift my foot up, over, down slow. And I'm going to pick it back up, bring it back over, down slow. Okay, you want to sit up tall. It's kind of hard to do in this. Up, over, down slow. Okay, these movements should be done very slow, very controlled. Okay. So those are my 3 favorite hip exercises and stretches. There's a bunch of other ones in here as well that, you know, I could walk through, but I want to respect your time. If anybody has any questions, feel free to ask. So Kat, is a great question. When it comes to reps, it all depends on what you're trying to accomplish. If it's a tendonitis issue that we're trying to decrease, high rep, low load. Okay, so that means not very much weight. And we want to do 20, 25 repetitions. Okay. If you can get to 30, great. If we're trying to build muscle, if it's an issue like, hey, we're pretty weak here, we want to build the strength up. We want to have enough load that we can't really do more than, I don't know, 12 to 15. Okay, so that's going to help build the strength. But yes, very good question. There's a lot of science actually out about that, and people will very much argue which rep range is perfect. Well, honestly, just start doing it and see how you feel. Sure can, Ludovica. I get maybe a better view here. Okay, so I have something that's maybe 2-3 inches tall. Okay. I'm sitting in what we call long sitting. Okay, so I'm sitting up tall, but my legs are flat all the way out in front of me. The thing that I want to go up and over is right on the outside of my leg. Up slow, out just past it, down slow. Up slow, bring it back close to midline, down slow. Okay. If you have knee pain, would that band exercise be okay? Should be. It depends on where the knee pain kicks in. If you're going into a squat, and that's what triggers the knee pain, let's take a look at that. Let's see what's going on there, okay? If you can maintain that squat and it's not provoking of your pain, great. Going into that movement does kind of stress different structures in the knee. So again, depending on what's going on in the knee, it could kind of trigger it, but that would be actually good information for me to know, because then I can be like, oh, that movement triggers that. It could be this or this. That makes sense? Stretch for tight adductors. Great question. So that's your side lunge, okay? And I know, again, it's hard to see me. So if I want to stretch my adductors, I'm going to keep this leg straight, and I'm going to lunge out sideways. Okay, now all of this is being stretched. Okay, so it's like a lateral lunge. Ooh, your boy's tight. That's a good stretch. Okay, how long do we hold a stretch, guys? Who remembers?
30 seconds. 30 seconds.
At least 30 seconds.
Yeah, 30 seconds.
30 seconds is when the stretch actually starts getting what we call deformation in the tissue. Actually starts elongating the tissue. So yes, don't cut yourself short. Don't waste your time and only do 20, 25-second stretches. Okay, if we're trying to stretch the tissues, we want to hold it for a good 45 seconds. Okay. Let me see if I got my symptoms to a weak hip. The biggest one we see is the hip will drop as you walk. So if somebody takes a step, the hip will drop in. See how my hip kind of drops in there? If my hips were weak, when I take that step, my hips aren't able to hold my weight up, and boom, my hips will drop in. Okay, and if that's the case, a lot of times we'll see that bursitis right here on the outside because it's getting stretched out every single time you take a step. All right, guys, that's all I have for hips. I know it's a lot. If anybody wants me to ever elaborate on, you know, one of those topics in depth, I'd be more than happy to. I have nothing planned for the future weeks, so if you guys want to shoot some topics my way, I'd be more than happy to prepare something for you guys. I'm trying to come up with the link. Anybody wants to book something to come, let me check out your hip. Give me 1 second, I'll put that link up. Otherwise, thank you guys for being here. I went overtime today, so I do apologize, but enjoy the rest of your day.
Thank you.
You're welcome. Kat, if you come see me, I can hook you up with a couple different pieces of bands depending on which color you want. But we have these green ones that I always show. We have extra one of these that we like to hand out. So if you want to come get one of these, I'd be more than happy to give you one of these. Latex free, I do. Got them recently. Man. A little bit, yeah. Maybe I'll hang them from the roof so we can look like we're having a party.
Oh, jeez.
Kat, do you know what colors you would want? I have the green mini band. Otherwise, I have just a box of rolled up TheraBand that I can cut you a piece of if you'd like that. And I have all the colors on that: red, yellow, green, blue. So if you just want to let me know when you get here, if I'm here, I can cut you a couple pieces. Sounds good to me. I'll even give it to Gary so he has it for you. Party will begin at 5. I like it.
That's my appointment with him. Okay, if there's no more questions, we're going to go ahead and end the session and kick everyone out. Y'all have a good rest of the day. Bye.